We were diagnosed like really early. My mom said she noticed something with my neck and she decided to go see and get it tested to see what it was.
We've had scoliosis since we were babies. It got worse when we grew and it kept curving and mine was worse than hers. So.
It's posterial spinal fusion.
Posterior? I think it's posterior.
It's a metal rod they're screwed into our spines so they're not like curved anymore. Hers is an S and we call her Shauna, which is kind of funny because it starts with an S. She has titanium and I have stainless steel.
Mine are longer. They start from the shoulder line to right above your hips. Well, we grew a lot taller.
I think I grew 1.5 inches like immediately after the surgery. Like they measured us the day before and a month after, and it was 1.5 inches for both of us. And now I'm taller than my mom, and I'm almost as tall as my dad. He's pretty tall.
And I'm like a little bit almost as tall as my mom.
When they were first diagnosed, their pediatrician actually sent us to see Dr. Jofe at Joe DiMaggio since he's the spine specialist.
One of the advantages of coming to Joe DiMaggio to have your child's scoliosis surgery is that the team is very experienced. So there are no interns, residents, or students involved in the surgery. It's myself and my partner who are both very experienced scoliosis surgeons. So it's a very experienced team that has done many, many scoliosis surgeries, performing and participating in the procedure.
Mainly, you want to know that you're somewhere where you're going to be well taken care of, that this is an everyday occurrence. You want somebody to correct your child's curvature who's very experienced.
We use the latest technology, the latest instrumentation systems. We monitor the spinal cord electrically with a very experienced electrophysiologist monitoring both the sensory functions and motor functions of the spinal cord.
It goes back about 15 years now when I first saw the surgery to correct scoliosis, and I was so astounded by the miraculous transformation that occurs in front of your eyes as you see that spine straighten out, and also the transformation that occurs in the patient, because to have scoliosis sometimes can make you a little bit shy about your presentation, about your appearance. When you see a young boy or girl who formerly had been somewhat shy and retiring, perhaps embarrassed about their appearance, to be transformed essentially within a few hours to the point where their personality changes is kind of rewarding. So you get the reward both just for the actual surgery itself, which just is a challenging surgery, an enjoyable surgery, but a challenging surgery, but you also get this beautiful transformation that occurs in the patients themselves. It's one of the things that makes, I think, treatment of scoliosis kind of a special match between the science of the medicine and the humanity of treating the patients.
For me, to examine the child post-operatively and after I've been following them for months or years and have watched their curve get worse and their clinical exam look less attractive, to see them post-operatively come back with this beautiful straight back and nice symmetric waist, I mean, it really is amazing. The majority of the patients with scoliosis do not need surgery. Many of those patients are just treated with careful observation. We kind of monitor them as they grow and go through their adolescent growth spurt. And if the curvature is mild, we just observe them, and you can go on to live your whole entire life with a mild curvature and it never will really affect you in a negative way.
For Deanna, and she was going into high school, her shoulder blade was really sticking out, and I think she was becoming a lot self-conscious about it. You could see it sticking out behind in her shirt and everything like that. So it most definitely changed that for her. Like I said, self-confidence, all of that stuff going into high school. For Roshawna, her curve was a little bit more, and her hip she was kind of off kilter, if you want to call it that. Having the surgery, she walks straight, she holds her head up, and both of them, they're very self-confident, and so I'm really, really glad that we had the surgery done when they did it.
There's a number of reasons you should come here, but the main reason is because we have such a wonderful team approach. You've got an amazing surgeon who has excellent results. You've got nurses who are very familiar with taking care of this particular problem. It's a very common routine operation that's done here in this system. And the team approach is really important because it's not just about the child, it's about the entire family.